Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
All right. Welcome back to This Just In Radio Show, broadcasting live from HIMSS 25 in the AMD Booth 4471 in sunny Las Vegas. We're excited to introduce my next guest, a new friend of the show, Normand Champigny. Welcome to the show, my friend.
Thank you. Happy to be here.
My favorite name of all my guests, the entire show. I have 40 guests here at HIMSS, and you have the best name ever.
Thank you so much. It's a beautiful French name, and you say it so perfectly.
Awesome. Thank you.
My parents would be proud of you.
Amen. I love it. Co-founder, managing partner of Azentys.
Correct.
So, tell us a little bit about Azentys, maybe 30 seconds before we dive into the questions. Tell us about Azentys and what you guys do.
Yep, exactly. What we do is we provide a structured methodology for a partners alliance ecosystem. So our value is we provide a methodology that our clients will have a partner alliance ecosystem that is going to be scalable, repeatable, and reportable for mutual revenue gain, right? To help monetize it. As well as in healthcare, in this example, is that the joint mutual value proposition is going to be that it's all about patient outcomes and patient care.
Excellent,
yep.
Excellent. So, before we dive in,
sure.
I will follow-up question to that. Who here, because I always love to learn, so does my audience, who here would be a big customer for you to reach out to? Who do you want to speak to while you're here? Who have you spoken to while you've been here that you like? That you said, you know, they're a great fit for us?
Yeah, I did a lot of walking around and observations, so it's not one in particular vendor.
Yep.
What I do see perhaps is a use case, right? And we're seeing it really needs, what I'm learning here is, here at HIMSS 2025 is cyber resiliency. It's very becoming, right? And
Absolutely.
a lot of partners are really not struggling, but they have to grasp, right, the methodology around that and how to partner with that. So I see that as an opportunity, as one of the opportunities. So there's no really particular vendor.
Yep. The use case.
But if I can extrapolate on that, sometimes a small to medium-sized organizations that need the skills or fractional executive means, we can do that as well. Or maybe like a large organization, say, we grew so fast, we have no structure in place.
Right.
And we don't have a scalable, repeatable process.
Right.
So we have a mutual monetization agreement. So those are opportunities as well.
Excellent. Well, congratulations.
Thank you.
So, I like to start my show off with something positive. What progress do you that you enjoy seeing in the industry right now that you most like to see?
Well, I like to give a historical perspective. End of day, I'm a motorhead, right?
Yep.
I'm all about. I cut my teeth with storage, networks, servers, networks, and like so.
Is that where you met our friend Tony? Is that where you met our friend Tony Nunes?
Yeah, exactly. About 30 years ago. Yeah, we have a lot of great stories to tell, and because of great leadership, we've done very, very well in our careers because of that great leadership. But just to give a historical perspective, like 30 years ago, my first industry expertise was in banking and finance. So I would visit these accounts and develop some, type of architectures when you need to grow.
Yep.
And the CIOs and the IT directors would be really so proud of the data center. They would show off the data center, and I would walk in the columns of the servers, the storage, and all the lights are blinking, very nice and neat. And it was important because in banking and finance, it's people's money.
Right.
End of the day.
Absolutely.
Then all of a sudden they said, "Hey, Norm, we need to expand in healthcare." I knew nothing about healthcare. I said, "All right, let's go." And with that said, I go to an account and learning about healthcare, and my mentor said, "You got to be careful because what you're going to learn is in healthcare is you're going to see the museums of technology because they didn't have the budgets like in finance and banking, and that's what I learned quickly." And let me give you an example. I went to go see a customer, and we're talking about PAC systems. He goes, "Hey, Norm, let me show you my back end, how I'm going to support that." He gives me a tour of his data center, and I see an OS2 in 2006, an OS2 server backing up data.
Yeah.
And that's why I recognize concern. So to extrapolate on that then it came about in 2009, is where we had a high-tech act. And that really helped foster and catapult.
Absolutely.
Right? The healthcare providers going to an EMR platform. And that did together is EMR connected, it extrapolated to EHR, all the other data systems. And that, hence, finally at parity is these healthcare providers are able to share and protect, manage data for patient outcomes.
Absolutely.
So third is that really spawned, right, a huge alliance ecosystem. So just look at this booth here, right? You see all the partners. Look at all these booths, right? They proudly display their partners, right? And that's critical because I mentioned earlier, together they need to have a partnership with mutual gain for the end user, right? And that is for patient outcomes.
That's excellent. So what, fantastic, and I totally agree.
Thank
what
you.
trends do you see out there in the industry right now?
I've been thinking about that and walking around, and I think it's what we're about to see. And what I mean by that, Justin, is just recently we saw the healthcare pricing transparency executive order.
Yep.
And I think that's key. And I was a little disappointed in some of the pundits really saying that it's a bad thing and negative. I think we need to turn that into a positive thing. Because here's why.
Yep.
If you look back in 2010, we had the Affordable Care Act, right? And we had to contend with it. But however, with the healthcare transparency pricing executive order, we have an opportunity to be more competitive.
Absolutely.
What does that mean for the providers? It means that it can probably deliver more care, more effective, more of a better delivery stream for patient care and outcomes. Not that they're providing back care now, it's going to improve the delivery system. And with that said, it gives the opportunity, right, to develop new procedures, right, into healthcare provider space for delivery, because streamlined for better patient care and outcomes. And it's going to get an opportunity for patients to see, I want to go with this provider because I can now see what the pricing on my affordability. The other thing is important as well too with that is, the transparency is, it's going to spawn new business, right? So it's going to spawn new outcomes and the like. So second is that with the Department of Healthcare, Department of Health and Human Services,
HHS,
is that I think, I predict some of the outcomes we're going to see is much more better. We're going to probably see food nutrition being part of the platform, and
Absolutely.
that is key. So we're going to see a lot of behavior where patients are going to have more command of their own lifestyle, which is key.
Absolutely. Yep. So as a follow-up to that, how would you tell, what best practices would you tell people, hey, this is how you navigate, price transparency, or how would they implement that, or what's the next step for them to kind of go forward with that?
Well, here's the thing. The platform's already there.
Right.
But the platform's there.
They are.
Right? It's a matter of how it's being delivered in terms of, so for instance, everybody has a mobile device. Well, so if you have a patient that just went to the doctor, you need this X procedure, right? I now have, as a patient, command of where I want to go, right, to have those services and the like. So another area is, an example of that is, I would say, I think what you see the healthcare providers use an untapped resource, and that would be, like, for instance, the registered licensed dietitians. Again, this is coming from my previous questions, right?
Yeah.
With the Department of Health and Human Services,
Absolutely.
we're going to have an untapped resource that's going to come into bloom, and that's going to be like registered licensed dietitians, because it can be part of the mix of that. What we're going to see, to add to that question as well, too, what we can see the outcomes is going to make precision medicine much more effective.
Yeah.
So we're gonna look at this healthcare transparency pricing in a positive spin, in my opinion.
I completely agree. I love it.
Thank you.
That perspective has not been brought up on the show yet for this conference, so I love it.
Right.
Thinking beyond today, what do you see as a trend or a strategy that we have to be ready to navigate in a few years from now, in 2 to 3 years from now?
I just walking a lot, walking around, observing. I attended a number of sessions, and like I mentioned earlier, cyber resiliency is going to be key. I think the healthcare providers did a great job in regards to looking at cybersecurity, which is zero trust, encryption, the keys and the like. Now they're going to have to look at cyber resiliency. Now we're looking at cyber resiliency is about how effective if they can bring up the healthcare data workloads, right? To resume patient care immediately, because when we have a ransom attack, right, what we're seeing at stats now to full recovery is 24 days. Yeah. We're dealing with patient lives. Yeah. Right, and this is why you're seeing the providers paying the ransom. I don't want, if I was CIO of a company or CEO, I don't want to be at fault because a patient died because I didn't pay for the ransom. Right. So they're very vulnerable. So when we look at cyber resiliency, it's very key. With that said, the healthcare providers really have to put a methodology in place and practice it. They just can't develop one and store it and use it in emergency break glass. They can't. They got to use it. Right. So the other point is, answer that question is, you're going to have the cybersecurity team and the infrastructure team and cyber resiliency work together. They can't go head to head. And that is key for the CISO of these healthcare providers. Right. The other thing I want to see is, the second I would say, it's really encouraging to see the innovation. Yes. Every year, AI and the like, and it's very encouraging. I feel very encouraging in healthcare provider space. However, as we look at AI and a lot of tools to augment the practice of these physicians and clinicians, is we cannot forget one key thing, and that is the oath, right? First, do no harm. Right. And that's key. Yeah. As we look at it, because they can't forget that mantra. The other one is, as we deal with AI and the like, is that, in my opinion, we look at healthcare and we look at AI tools, fantastic, but I think that AI has to equate with EI, the emotional intelligence. So when the clinician provides, when I say emotional intelligence, they still have to provide the bedside manners. Right? We can't take it away in a sense. So those are the 2-3 things I see.
Yeah,
for
no,
the
and
next
I'll
few years.
even to give you some more stats on the cyber threat and what it means to our industry is I think the average ransomware attack costs, or the average it costs about $32 million, but the actual ransom paid is around $5 million, and it costs $1.9 million a day to be down as a care provider.
Yes.
That's just the financial cost. Never mind all the care is not provided. So it's, it's significant.
Exactly. And what's key, again, I think cybersecurity is there. I mean, that cybersecurity, it has to be a work of yin and yang.
Right.
When we look at cyber resiliency, it's all about how fast at scale and speed, right, to have workload recovery. So that could be the EMRs, for instance, right? It can't be read-only. Right. Well, we can have read-only for 7 days. No, this is, we're dealing with patient lives, right? And it's very key. So I think cyber resiliency is going to be on for the next few years. And if I can just touch upon that too, as well as in Europe, we're seeing DORA, the Digital Operational Resiliency Act, which means all the banks have to prove they have a cyber resiliency practice in place.
Right.
They have to demonstrate that they can recover in 2 hours, and also demonstrate their forensics and evidence thereof, and also to have penetration tests, meaning that they have tested, right? Yep. I'm not a big regulations guy, but we need something like DORA in the healthcare space, right? So early on I said that, one time is, the healthcare industry would like the technology museum, and that changed a lot, right?
Right, absolutely.
But today, let it be banking, healthcare, any other industry, cyber resiliency is a really concern.
Yep.
I mean, they
agree. Norman, thank you very much for joining us on air. We'll see you soon, my friend.
Fantastic. Thank you very
Excellent.
much.
Thank you.
Thank you.